Nearly 7 weeks into lockdown, New South Wales is in deeper trouble than ever. Despite a surge in cases, an optimistic Gladys Berejiklian is looking to a time when restrictions can ease, possibly within the next few weeks. That's setting off alarm bells at National Cabinet. The daily numbers are now nearly 3 times what they were when the Premier described this as a national emergency. Today, the state posted 390 new infections. Only a quarter of these are known to have been in isolation while infectious. 2 more people have died, a fully vaccinated man in his late 90s and an unvaccinated woman in her 40s.
A police welfare check turns to tragedy in Cabramatta. A woman in her 40s infected with COVID was found dead inside her family home. She only had the virus for 6 days.
What we do know is that the health services were in contact with the family in the days preceding her tragic death.
A man in his 90s has also died in Newcastle. He'd had 2 doses of the vaccine but was in palliative care.
I know that every day when we read the statistics about the deaths, we often remember or don't remember that behind every single statistic is a loved one, a family, and many carers.
Another 390 people have the virus. That's a record high. The crisis is deepening despite tougher rules being in force for weeks.
I anticipate, given the large number of cases we've had in the last few days, that unfortunately this trend will continue for at least the next few days.
The virus has torn through hospitals, aged care homes and now a school for autistic children. 10-year-old Imogen Golder goes to Giant Steps in Gladesville. She's isolating at home.
I think our biggest challenge has been trying to explain to her why all her favourite things and all of her supports and all the people that she sees as her safe people have been taken away.
18 cases are connected to the school. 7 are students. Children like Imogen will be cut off from carers and vital services for at least 2 weeks.
These hard lockdowns do not work for families like ours in terms of, I feel like they're causing more issues than addressing the problem.
The epicentre of this outbreak is still here in the city's west and southwest, but the virus is spreading through more suburbs. Health officials are now warning Blacktown and Mount Druitt should be on high alert.
Delta is an extremely dangerous weapon, and some people are allowing it to be used as a weapon because of their ignorance, their stupidity.
But the Health Minister has shut down talks of a statewide lockdown.
That's not been proposed to me by the health officials at any point.
A point no one wants to reach.
Cayman Gock joins us now from Blacktown. Cayman, the state's crisis cabinet has been meeting this afternoon. What's been decided?
Well, Jeremy, there are quite a few changes and they are significant, starting with an overhaul of the singles bubble. Now, this will only apply to people who live in those local government areas of concern, but you will have to register the person you want to visit your home and they have to live within 5 kilometres of your house. The state government is also set to introduce isolation payments. Now, these will be for close contacts who have to miss out on work. You will receive a payment from the government starting from Monday. Holiday home restrictions will also be tightened. You cannot travel to your second residence unless it's under special circumstances, such as for maintenance. But even then, only one person can go. You can't bring your partner or your family. And finally, you will need a permit to leave Greater Sydney. Police will be out on the roads pulling up drivers, ensuring and checking they have the right paperwork if they wish to travel to the regions. Jeremy?
Cayman Gock reporting from Blacktown. It's rapidly evolving and concerning. That's how health officials are describing the situation in the state's Central West. Another 19 cases have been found in the region. Aboriginal community leaders are pleading with people to protect themselves and others by following the lockdown rules.
Wiradjuri woman Tatum Moore has joined the long line for a COVID test in Dubbo. The growing cluster has left her and many others shaken.
It's definitely a scary time for everyone. There's a lot of uncertainty. As we've received word that, COVID-19 is transmitting quite quickly amongst our First Nation communities.
19 new cases have been discovered in the region. Most are in Dubbo, but there are 2 new infections in Walgett, the remote community that has authorities especially worried.
The large proportion of the new cases and our total cases are Aboriginal people, both in Dubbo and Walgett, and many of those are children.
And there are warning signs the virus could be spreading much further.
In the sewage detection, there has been COVID-19 detected in the Bathurst region, Parkes and Burke.
People in large, extended families who usually interact between different households are being urged to stay apart.
I need everyone to start doing the right thing for our whole community, not just for my family, but for everyone else's family.
This testing clinic has been set up specifically to cater for Dubbo's Aboriginal population. Studies show Indigenous people face poorer health outcomes in general, making them more susceptible to COVID-19. Thousands of extra vaccines have been sent to the region.
We would have all liked far more vaccine to have been in those more remote communities because it was identified last year.
Health officials are now desperate to catch up to limit the fallout from this outbreak. Gary John Lysart, ABC News, Dubbo.
Let's take you now to another of the affected regions. Ben Millington is live for us in Newcastle tonight. Ben, you have new details on how the virus spread in the Hunter.
Yes, Jeremy. Police say 2 women from Western Sydney, aged 20 and 21, travelled to the Newcastle region on 2 separate trains. Police stopped one of the women on the train and actually told them to return to Sydney, but it appears she defied that order because she wanted to go to a party in Newcastle in the Shortland area, which we now know is the source of the outbreak here. Police attended that party as well, where they found both women, and again, orders were given to return to Sydney, but they didn't. It appears, or it's alleged, that they went to multiple venues, pubs, and to a gathering at Blacksmiths Beach. Last night they were charged with breaching the public health order, and police say more charges could follow.
Police will be alleging that both of those women have a history of non-compliance with the public health orders. And I've got to say that people travelling to regional areas from Greater Sydney are putting regional communities at risk.
Meanwhile, a 19-year-old man, Christian Radovanovic, has been charged in relation to the Byron Bay outbreak. It's alleged that he travelled there with his father, Zoran, and both of those men will face court next month. And in some better news, here in the Hunter, we had just 5 cases of COVID today, which is down from 24 the day before, and only one of them was infectious in the community, but there are still a number of exposure sites that are of a concern.
Ben Millington reporting. There is some promising news tonight. New South Wales has reached an important milestone. More than 106,000 jabs went into arms across the state yesterday. That means half the population aged 16 and above has had at least 1 dose. More than a quarter have had both shots. If we can keep up the same pace, 80% of people will have some protection within 39 days. And the Premier says we should reach the target of having 80% fully vaccinated by mid-November. Construction workers are being encouraged to join Sydney's Super Sunday inoculation drive this weekend, and under 40s, along with essential workers in the city's hotspots, will be offered the jab next week.